to do is to try and help people of 65 and over who live in Wellingborough to have a best quality of life and best experience of health and well-being that they can for as long as they can. So it has very much a prevention element to it, but it also has a response element to it.
We looked at data from Wellingborough. We looked at the demographic trends. We knew that this was the area that had the biggest proportion of older people admitted to acute care. And we knew that the elderly population was above average in this area, so it seemed like a good place to start. It's very much about trying to give the best coordinated community response that there could be, and that might be that there's a bit of nursing input into that, it might be that there's some input from the GP, it might be that they could come along to a group that's run from the voluntary sector. It might be that they go to a day centre, and I think by all working together we've got a much better chance of doing that than kind of working separately, really.
At 12 o'clock midday we have a whole group of people who come in to join us from various voluntary organisations and from Northamptonshire Adult Social Services. So we look at people who are being discharged from hospital, either off accident and emergency or off the wards, or we respond to requests by the likes of a district nurse, a GP or indeed a pharmacist, anybody else connected to that sort of world. And they come into us and we sit and have a look at the lists that are coming out of KGH and any other referrals that we've got. We split the calls up and then we'll come back together in a huddle and we'll discuss, okay, so what do these people need? Do they need anything? What sort of response do they want? Is it longer term? Is it immediate? If it's immediate, that same team have already been granted permission by the various organisations to form a virtual team so they can physically go out and visit there and then and address whatever needs it is that are immediate. On the other hand, if it's something that's more long term, then we'll decide between us who's the most responsible person, who's got this sort of job that would make that right for them to do, who's got the resource, and they then will go away and do that piece of work.
I had a phone call from a surgery and it was about a lady whose husband's got heart problems. The wife has got onset dementia and she wouldn't leave him because she was concerned about him. I went out with permission from the daughter to speak to her and I said to her, look, why don't we go out for lunch? Just me and you on Monday. And she went, yes, okay. So with her husband's permission, I took her to Glamis Hall. We had lunch, she played bingo, we had a raffle. She thoroughly enjoyed it. She didn't realise she was at a day centre. I think when you speak to patients or clients and you say to them, I'm taking you to a day centre, they see a day centre as old people sitting around doing absolutely nothing and being dreary. But if you tell them they're going for lunch, they see it in a different light. It's just getting over that hurdle. So through her daughter and her husband, we've arranged for her to go back every Monday to the day centre in hope to increase it, to give her husband time to rest and he's not having to worry about his wife because she's in a safe, secure environment.
It makes a huge difference. This is providing a service that it simply wasn't there. Every time I've rung somebody, they've been really pleased that somebody's bothered to make that contact. Even if they are genuinely absolutely fine, they're coping well, they're really appreciative that someone has been in touch to see how they're getting on following their discharge. Yeah, it's been very, very positive.
There's so many people doing such good bits of work. The problem is quite often the cement that joins it all together isn't there. And I hope in some way or the other we're a form of yoo-hoo because we tend to know who's out there and what they're doing, or at least have an understanding of it so that we know who the best people to talk to are.
I'd like to feel that we've made a difference to people, and we've sometimes been able to make a difference when people are in vulnerable situations, so perhaps after a hospital discharge. I think we'd like to feel that we've kind of joined up what a community offer can look like. And I'd really like to see, as we've seen with other pieces of work, people attending and being more part of their local community than perhaps they were before.